I'm ready.
Okay. 응답하라 여친.
Go to the into the she.
Back to the gang to the Jew. Hey. So Jane,
we have a very special guest joining us today.
I'm so excited.
Yes, she just flew in today from Philly. This is Dr. Karen Tang.
Woo!
Welcome.
We are fangirling so hard.
Yes.
Oh my God. I'm so excited to be here.
I mean, I feel like I know you for years because I've been following you for years, since 2020. But Dr. Karen is, a lot of you may know her from TikTok and Instagram and YouTube, but she's a board certified gynecologist, also a minimally invasive gynecologic surgeon. And she's
Mom of
here
three.
today, mom of three. I mean, we have to ask her how
and in
she
between,
juggles it
I
all.
wrote a book and stuff.
Yeah, she also wrote this book.
And an
It's not a
author.
big deal. It's only like
just a
350
bestseller,
pages.
you know.
It's like everything in women's health.
Yes. So welcome.
Thank
welcome
you.
to
This
the
is so
podcast.
fun.
Yeah.
And I feel like I've known you forever too. And Ellen, I feel like I've known forever, even though we just met like 5 minutes ago. But I feel we're all family already.
Ellen has that aura
The
about
good
her.
energy,
Yes,
yeah.
yes.
Well, you know, I just am just so happy. I've been hearing Jane talk about you forever.
Oh my God.
And I became like a fan through Jane. But this is so exciting. And just hearing about all that you've accomplished. I mean, were you just born an overachiever?
I joke. I'm like, I'm a lazy person who sort of became an overachiever accidentally. I don't know.
I don't believe it. How many hours
know.
do you sleep?
Oh, it's not many. It's not.
I
a lot.
knew it.
It's like a 5 to 6 hour per night situation.
Wow.
But that's partly because I'm like all the other people who, by the time you get to the end of the day, you're so just like, I just need to like take a little time for myself, just like scroll and do mindless things.
Yeah.
After
You do that?
Oh, I totally. Yes. I mean, because you spent the whole day taking care of other people, and you're like, I
Yeah.
just need to like just look at dumb things on TikTok for a while, and that's how we met each other.
I know.
You may not realize that Jane and I actually have a common connection in that my sister is her friend in real life.
That's
and
right.
We didn't learn this until we were already social media friends.
Yes.
Somehow we discovered that we had my sister in common. My sister
Yeah.
Jen was friends with you in Michigan.
That's
So-
crazy.
Isn't that
What
wild?
A small
I know,
freaking
she's so-
world.
such a
Jen
small world.
mentioned, back in 2020, my sister just started doing TikTok and Instagram, and, she's a surgeon. And I said, wait.
She's just a surgeon,
Dr. Karen Tang is your sister?
Karen Tang.
Yeah.
The
The
Karen
The
Tang?
Tang. Well, so I'll say, immediate follow from me because your videos were so right around the time of the pandemic. I was following a lot of doctors because there was so much misinformation out there. And here was TikTok on this channel where doctors were kind of giving us like the real look into what like healthcare looked like during the pandemic. And I was like personally invested as a mom and as a wife of a healthcare provider. And then I stumbled upon like your videos, and they were so educational. A lot of times it was about debunking these common myths about women's health.
What was the myth that like she enlightened
Drew
you with?
you in.
Oh, yeah.
I don't remember
There's so
the
many.
one.
Yeah. Oh,
I
God,
really
there's
don't,
too
but
many to
I
pick
do
from.
remember
Yeah.
the one that catapulted you into like
Ooh.
viral
Yeah.
TikTok fame, and that's one.
Wait.
Yeah.
Would you know what that is?
Oh, yeah.
Yeah, she knows what it is. I
Oh,
wonder
gender
if
and
you've
sex
seen
one,
it too.
yeah.
Yeah, so she's totally like debunking the myth that like chromosomes determine your sex.
Oh.
It was Marjorie Taylor Greene at the time. who
Right.
was saying,
Of course it
there's male
was.
and female, and like that's science, and like if you don't believe that, it's not science. And so, too long to go into here, but there's a difference between gender and sex, and neither is binary. There's a whole concept of intersex where people, their chromosomes and their hormones and their organs and their genitals don't kind of, like uniformly follow a male or female pattern. And I was just like, this is ridiculous. This is not science. Like, so, it was literally like a Friday after my clinic. My hair was a mess. I still remember this because this video blew up, and literally like celebrities were sharing it. Everyone was sharing it.
Wow.
And I was like, oh my God, I look insane because I just literally like decided off the cuff just to kind of throw out this
You were
video.
like, okay, listen,
Let me,
I'm
like,
gonna,
lady.
you're like, I gotta.
I was like, keep science out of your mouth. And so,
Yes.
It was such a clap back.
Oh my God.
Wow. I mean,
It irked you. You were
It
like,
really
I
did.
am called for duty right now. I don't
Yeah.
care where I am. I gotta put my
I
two
think
cents
I like
in.
gestured angrily at my diplomas. I was
Yeah.
like,
Yeah.
actual experts know that this is not true. And so, and it really struck a nerve, which I really was happy about. I think people were looking for someone to champion gender diversity, and the fact that like scientists and doctors actually support these things. It's not just a matter of opinion. Like, this is scientific facts.
Yes.
And I take that into a lot of the videos too. There's so much misinformation now about so many things: birth control, IVF, abortion. That the medical community like supports a lot of these things, but somehow has gotten turned into it's a matter of like someone's opinion is right or someone else's opinion. I'm like, no, like most of these things are not like opinion issues. It's there's a very clear medical community supports these things, and I think people are excited to hear a doctor actually kind of like take a stand on some of this stuff. So I think that's why it did well. I'm not obviously like I have a fraction of the followers of Jane, but as far as doctors go,
but I mean, you have real educational impact, and I think the ability to, what, my husband on his own saw that video too.
That's
and he
right.
shared
Yes.
it back to me.
Wow.
Yeah.
Isn't that crazy? Yeah.
That's
Yeah,
great.
and this issue came up again recently with the Olympics.
Yes.
the
Yes.
Summer
That's what I was
Olympics.
gonna bring up. The
Yeah.
Olympics.
Exactly. Yeah, exactly
Ooh.
right. So I had to kind of make a couple of videos around the time with the boxing controversy and all of that. Yeah.
Did you always know? Of course you did know that you wanted to go down this path.
No. So
At what age did you know that you were going to be a doctor?
I knew it. Yeah, a doctor early on, and I will say there's been a couple of times in my career where I chose something that I would never have thought I would do in a million years. So first of all, doing surgery. I started in medical school, and I thought surgery is something like men did, or like people who were like really confident in themselves. I'm like, I just want to do like primary care, and like keep my head down and not get into trouble in the OR. And I discovered I really loved it. I'm like, this is great. I played violin. I had a lot of like kind of like manual dexterity. And the surgeons were like, you're really good at this. I'm like, I am good at this.
And Dr. Karen, she's like a tiny person.
Yeah, very small.
I'm trying to imagine you like in the OR.
Oh,
like,
yeah. Oh, that's what I mean. In my mind, I thought this was something that like dudes did, and that I'm just like I'm like 5 feet tall, like small, woman, and it was really gratifying to hear surgeons being like, oh, you have a real skill for this. And then, so that was a surprise to me. And then the social media thing, total surprise. I didn't do any social media before 2019. None.
Wow.
I had no Twitter. I had no Instagram.
Same.
But
Nothing.
you're so
Nothing.
good at conveying information. And where does that come from?
Yeah, I've always loved teaching. So from early in my training as a medical student, as a resident, I loved to teach either people who are younger trainees or patients. So that was something that was really, I really enjoyed. Breaking things down in a way that was really easy to understand.
The way you talk, like that energy, your aura is like so informative, but not in this, some people
Not
have
pedantic,
condescension.
like,
Like someone that genuinely wants to be like, oh, here's something I want to tell you.
Yeah.
And it has such a care to it that you draw people in.
I love you.
I know, I'm
I'm
always
going to
like-
move to Seattle and hang out with you guys all the time.
Please come to our Korean barbecue.
Well, I'm always telling Karen, I wish you were my doctor
Oh,
because
my
I don't
gosh.
think I've ever, I'll be 40 in February, but I still get really nervous about going to see my OBGYN.
Wait, would you really though?
Would I really want her
Now,
to be my
yeah.
No, I wouldn't mind.
Yeah.
anymore.
Really? You'd be like, if you move your practice
I'm
to
really
South
good
Korea,
at Karen.
I take care of friends.
She's professional.
Yeah, absolutely. I mean, obviously, not everyone, they have different levels of comfort, but I totally take care of friends. I've
For
had
some
friends
reason,
take care of me.
I don't want you to see my
So you
vagina.
don't have any, but it
Everyone's
doesn't
their own
weird you out.
boundaries.
Yeah.
But,
I'm like, doctor, I don't want you to judge me based on my vagina.
that's all right.
I mean, just because if we were on a friend level,
Yeah.
do you comfortably talk about your vagina?
No,
Sorry,
no.
why am I
Do-
saying
do
it's
you?
with so
No,
much?
Do you? I
Oomph.
don't. I don't.
Oh, okay.
Yeah.
Yeah.
Do you?
No.
Yeah. No.
So this is what I want to change. And so
Oh,
part
you
of
did?
it-
We also grew up very repressed.
Yes.
Asian
Yeah.
American.
So back to
Korean
the
family.
surprises. Yeah, I mean, when I was a kid, we didn't talk about sex at
No.
all, bodies, periods, nothing. It was very much like somehow I guess my parents just expected that we would learn it from somewhere.
Exactly.
Yeah. Oh my God, that's totally true.
Exactly.
Like somehow this information would get to you.
Yes.
Yeah.
Adana or my husband told me.
Yeah.
I was like, "Did you guys have the sex talk?" He's like,
Oh, never.
No.
No.
No,
Never.
we never had the
Never.
sex talk. It was just like, don't get pregnant. Like, but how
Don't
do you
do
get
it.
pregnant?
Yes.
Well, I was telling Karen a lot of the topics in your book, which we'll get to in a second. The last time I've read about it was learning about it in sex ed, which was like the summer between 9th and 10th grade for me. And I'm like, oh yeah, even the anatomy.
Uh-huh.
I
Or even
love
if
that.
you ever heard it, like if so many people were
Yes.
like, we didn't learn anything in sex ed. Like they
Yeah.
would just learn about a condom and don't get pregnant, and that was it. There's so
Right.
little sex ed.
Right.
So a lot of times when I have the videos, I'm not presenting like groundbreaking research. I'm just like, here's like the basics. Like this is actually like what your uterus and your ovaries like look like, what they do. Here's what a pap smear is. But so much of it is things that people have never heard before. So one of my most viral videos was showing footage of a hysterectomy, and it was literally just like, here's your uterus and your ovaries and your rectum and your bladder, and people were like, oh my God, because people had never seen these things, like, in their own body. They didn't know what it looked like. They know what the little cartoons of, the uterus and the
Yes.
ovaries, but in real life, it doesn't look like that.
No.
So, I wanted it to make, back to what you said about, do you feel comfortable talking about this? I kind of feel like people should feel comfortable.
Yeah.
Part of the reason women's health is so bad now is because it's been kept sort of so silent and like, it's such a stigma around it that it doesn't get treated like real health. Like, diabetes, cancer, strokes, so much research, so many presentations, but, vaginal health, sexual health, it's supposed to be like quiet. And if you have a problem with it, you're supposed to just deal with it and suck it up. It shouldn't be like that.
No.
I had this revelation. My husband recently like injured his hip, like he had a pinched nerve, and he had no problem like telling his boss, his colleagues. He's like, oh, I hurt my leg. I have to go to physical therapy.
Everybody,
Yeah.
listen, I got this.
Yeah, I hurt. But like, God forbid a woman has like a
Hemorrhoids.
UTI or hemorrhoids or
never.
her bladder's prolapsing or she's
Yeah.
having like problems with orgasms. Like she would never tell her boss.
Well,
I
I will
remember,
proudly say I
Yeah.
did an hour on my hemorrhoids.
Nice. That's good. That's good.
Yeah. But again, like hemorrhoids, like a man can relate to that,
Yeah.
right? It's
Well,
not specifically.
I didn't know that it could be so
I
bad
think real bad. Yeah.
after childbirth.
Yeah.
Oh, yeah. Oh,
That
yeah.
was I
sure.
was so depressed. Nobody had told me that I would just not want to get out of, like, I've had hemorrhoids before. But this was like the village of the damned.
Oh, the pressure on the blood vessels is real. It's a lot.
And I was crying every day. I was like, I and I wanted to talk about it, but who do you want to, I don't really want to talk about it. It was so, I think that was after Sawyer. So it was like, and then the postpartum hit me really deep, and all that pile on, I was the most depressed I'd ever been.
Yeah.
And
Yeah, and people should be able to talk about this. And I call it the Emperor's New Clothes phenomenon, where like everyone's kind of like, oh my God, I'm like the only one who like feels. And then once you start talking with your friends, you're like, everybody has these issues. Everybody has period problems, vaginal problems, bladder stuff, sex stuff, like fertility stuff, menopause stuff. Everybody goes through this. And then once you start to talk with each other, you're like, why have we all just kept this to ourselves like all this time? We could have been sharing this and like sharing resources and getting help. But that culture of secrecy and shame is part of what leads people to feel like alone, feel like it's just them. And then also like leads the medical profession to not take it as seriously either. So, I talk in the book in the first chapter about like, how did it get so bad? Like, why is it like this? And just talking about like history, about like how women's health was treated through history. It's like either you are like a witch or you were like, your uterus was like malfunctioning and that's why your body was going crazy, or you were in, like anxious, like Freud was like, everything was like women being anxious. And so all of that is still kind of conveyed today. Like people still treated like that a little bit.
I have a question.
Yeah.
Have you ever heard people talk about having innies and outies?
Belly buttons?
No.
Oh, I was
in the
like,
vagina.
Oh, vagina stuff. Oh, just the labia?
Yeah.
Oh.
I never heard that.
I never heard it phrased that way.
Until Matt, what's his face, Squidward, looking comedian.
Ugh.
I don't know. They think he's hot. You know that guy?
Oh,
His
that
name
guy.
Right?
Oh, the TikTok
Matt
guy.
Rife. Yeah,
Right.
the
TikTok
guy.
guy.
Yeah.
And then he like dismissed his audience, who's predominantly women that come out because they think he's hot. I'm like,
my
dude, your audience is not male.
Yeah.
Like, I don't know. And he was all mad about the fact that they're not male.
Yeah.
But he went on to say that he broke up with the girl because like he's not into outie
Oh my God.
vaginas. And I was like,
That's
I didn't know what that
that's
was.
like everyone. I hate to say this, but like, you know, if you don't have like
Everyone.
visible labia, like, I mean, it's like everybody has visible labia. So I have debunked quite a few videos on, there's always bro podcasts talking about this too.
Yeah.
It's like the exact
the worst.
opposite of this, where it's like just men talking about like judging women's like genitals and stuff. It's so very gross. And you have to do a lot of, you know, normalizing normal anatomy, because people will then, like, I see so many comments like, is it normal that it's brown? I like, you know, or like, is it normal that it looks like this?
Yeah.
I'm like, yes, it's normal. If it's not bothering you, it's normal.
Uh-huh.
It's like having brown
I
hair.
love that.
It's like
If it's
having
not
hair of a
bothering
certain
you.
length. It's like having a certain height.
Mm-hmm.
You know, if it's not bothering you, it's normal. And so sometimes people can have labia that are too long, where it's actually like hurting them with exercise or sex. Like, that's different. So, you know, sometimes people do labiaplasties because it's truly like hurting them. But, you know, just the way it looks, like, get the F out of here. Like, you know,
Yes.
Which is so funny that it's coming from men, because I feel like their junk is just not very fun to look at.
it's not very
I mean,
No.
if you want to talk about something hanging
Judging.
out, it's
Yeah.
that.
Yeah. Right? I mean, just look at this cover,
Yeah. Oh,
right?
yes,
I mean,
yes.
a beauty.
There you go.
Yeah.
Yes. I call it
Tell us
rainbow
about
vulva.
the cover.
Yes.
Rainbow vulva.
Rainbow vulva.
I love it.
exactly. Or vulva flame, I also call it.
Uh-huh.
Do you
It's
like the
a
Georgia
flame.
O'Keeffe paintings?
I do. I
Yeah.
do. And so the
Yeah,
little
reminded
story
me
with
of
the
Georgia
cover, for
O'Keeffe.
those of you listening and can't see it on
Yes.
the video, so it literally is like an oil painting of what looks like a flame with lots of different
Yes.
rainbow colors, and
I love
it's
that
clearly it could
flame.
be a vulva or could be a flame.
Yeah.
So the publisher didn't tell me anything about like what it's supposed to represent, but my interpretation is, one, obviously it looks like the Georgia O'Keeffe paintings.
Yeah.
And then number two, the flame.
Wait, you didn't choose it?
No. So, fun fact about covers or book covers, the author usually has absolutely nothing to do with what cover they choose.
What?
Yeah. The publisher chooses it. So
Really?
once they acquire a book, they have the right. They could do whatever. They could put a photo of a rock on the cover. Like, it's up to them.
So they showed you.
They
the
show us.
oh.
Yeah.
But you choose, right?
We help to
Okay.
choose.
Yeah.
Yeah. So
Okay.
we have, and some authors have no choice. Like, they're like, here's the finished product,
Mm-hmm.
and they have no choice.
Wow, that's
my
crazy.
publisher Flatiron was very collaborative, so they did actually present us different drafts of stuff. So I actually, you know, had sort of veto power and input, and we love this one. This was like the fifth
I love
cover.
it.
We went through quite a few covers before we landed on this one. The first one, I had told them I liked the idea of, like, say, like a uterus made up of something else, like flowers. So the first version, it was like too much, like it almost looked like a tampon commercial, where it was like they had like cotton balls, and it was too tampon commercially. So we got rid of that one. And then we had
I'm glad you didn't, because that would be a Blake Lively route that,
Yeah,
that nobody liked, right? Like
yeah,
overdoing.
so we scrapped that one. And then there was a beautiful cover that everyone loved, like from the, you know, like the head guy, the publisher, me, everybody. And it was an artist from Brazil who takes photographs of like of flowers in different arrangements, and so she'll do like kind of, you know, like a uterus and ovaries. It was beautiful. But then we discovered another book was using almost the exact same cover.
that's a good
It was like the same
catch.
color. It was almost the same exact figures, and we were like, well, we can't have two identical covers, so we scrapped that. And then we did a couple of other versions of things that just didn't work, and then they came up with this one. And the painter is actually the same one who did the cover for Adventures of Cavalier and Clay. I don't know if you know that one. It's like a watercolor of like the Empire State Building.
Oh.
So it looks like a graphic novel. It's very different in style, but super talented artist. And then, so I love this one because I think, you know, the flame, I say, could also represent pain, like fire hurts,
Yeah.
but it can also represent illumination
Mhm.
and, you know, like
Power.
a,
Yes.
you know, little spark starting a wildfire, like we're starting something.
Yeah.
So in my mind, like that's what I think it represents. Like again, the publisher didn't say any of that stuff. They're just like, here's a pretty cover. But
Yeah.
I
but
love
I
that.
like that. I
It is
think that it
super
represents a
eye-catching.
lot.
Yeah.
And it's
And
pretty.
then the title, it's not hysteria. Did
Love
you
the
know
title.
that's going to be my title?
My literary agency actually came up with that. I had a very pragmatic title. It was something that's like periods, pain, empowerment or something, which is I thought was a fun title.
The alliteration.
Yeah, it was
Wait,
like
what
very
is it again?
alliterate.
Periods,
Pain, and empowerment or something.
Okay, I actually kind of like that one
I
too.
liked it too. I thought it was good, but then they came up with, I was like, oh, It's Not Hysteria is brilliant.
Yeah.
The full title is It's Not Hysteria, Everything You Need to Know About Your Reproductive Health But Were Never Told, which I thought was like perfection. So, it captures how women have been treated throughout history, like kind of told it's in their head, that they're hysterical, they're overreacting, and saying it's not that. Like, here's some facts, like here's the reality and here's what you can do about it.
And that's a very choice word because when you think of the word hysteria, you immediately think it's tied to women.
Yeah.
You don't think it's a masculine term.
No, it's based on the word for uterus. Yeah.
What?
So hysterectomy.
Oh, I didn't even think about that.
Yeah, so hystra is uterus in Greek. So like back in the day, so actually you mentioned it in like the history chapter, like they literally thought that like, the concept of hysteria was like that your uterus was malfunctioning. So it's like your uterus was wandering around, it was making you sick. So
that wandering womb,
womb
image. Really stuck with me.
Yeah, it's pretty wild. They used to think that it was chasing stuff. So it's like it wanted sex. So if you didn't have an honest to God,
and it wanted children.
It wanted children. And so if you didn't give it sex or children, that's why you got sick. So they would prescribe get married and have sex if you were unmarried. I know.
They would prescribe that.
Yeah. And then so throughout the years, like you have like Freud, we were saying hysteria, that it's in the mind and it's your repressed anxiety making you feel ill or feel bad, and that you have to like calm your anxiety to
how many women have heard that though? It's a mind
Are you on your period?
You're exactly. Are you PMSing?
And that never feels like a valid reason to be irritated or more upset than usual.
And so a lot of times when people are told, oh, that's just normal, like there's such normalization of female pain. So period problems, perimenopause, menopause, there's so much talk about that now. People are speaking out about that. And they're told, it's just normal. That's just like women just deal with that. And if you feel like you can't deal with it because it's too bothersome, it's somehow like your fault for not dealing well enough with it, and that you need to, take an antidepressant or something. Now, antidepressants actually are effective for some things like PMDD, premenstrual dysphoric disorder, some of the mood things for perimenopause, hot flashes. So it's not to say that that's like, not an option, but a lot of people are given that because they're like, oh, it's just because you're too depressed, when it's not actually. There's a physical problem, but it often gets tied to your frame of mind. So and a lot of people do feel like I have friends in the UK and I did an interview with them and they said like fobbed off, and I was like, that's a great expression, I'm gonna take it. So like women feel like they're fobbed off, they're like like they're not helped. So that's part of why I wanted to write the book, and part of why I do the social media is to educate, to talk about if you're having painful periods, could it be endometriosis, fibroids? If you're having mood issues, could it be PMDD, perimenopause? Just to explain the medical stuff, and then what are your actual treatment options? And there's so much misinformation. People are so confused right now. Where like, are hormones good or are they bad? So just to kind of help to give them the facts so they can make those decisions about their body without, like falling prey to some of the misinformation.
Could I ask about perimenopause?
Yeah, do it.
Because I swear to God, I've never heard of that term until like
this past couple of months.
Like, why is
where
that?
was
It's
this
everywhere
education
now.
before?
Yeah. So what's funny is like as a doctor, I didn't realize that most lay people did not know about perimenopause because we obviously knew about it. But apparently like it's just not something that was talked about very much. Perimenopause, we also call it menopause transition, is the time before you officially completely stop having periods. So menopause is when you've had no periods on your own for 12 months. So like you've completely stopped ovulating, you're not having periods anymore on your own. So perimenopause is a number of years before that. Like your ovaries are kind of quieting, but they're not completely like, stopped functioning.
Mm-hmm.
So people can start to kind of like lose their periods, skip periods here or there, and you can get all the symptoms of menopause. So, you know, your hot flashes, night sweats, your vaginal dryness, but a lot of the things too, like sleep problems, waking up in the night, weight gain, like people can kind of gain weight around their belly a little bit more, have brain fog and
Story
trouble
of my
focusing.
life.
I know. Everybody's like, oh my God,
I'm
going through all this. Yes.
Is this my biography?
Yeah, like, you know, low libido, like all of this stuff. And so recently, a lot of celebrities have been talking about it. So Halle Berry, Oprah, Drew Barrymore. And I think it's because, like, you know, the powerful women got to a certain age.
Right.
And where they had a platform and they could be like, this is effed. What is going on?
Yeah.
And so then they have been speaking out. They've been bringing on menopause experts and a lot of, you know, kind of femtech is sort of like sprung up around this too. So people are talking about it. And the more people are talking about it, again, Emperor's New Clothes, everybody's like, I'm going through all those things.
Yeah.
So then everyone's kind of now going to their doctor. Now, to be fair, like I have heard through the grapevine from other gynecologists, like people who are just truly like going through something else, like are kind of blaming it on perimenopause when they're like in their 20s or 30s. Like, you know, like that's probably not perimenopause. But you know, if you're in your 40s for sure, 40s, 50s, like late 30s, your periods are starting to skip, you're having all of these symptoms, you kind of feel like you're going through menopause, that's perimenopause. And it can last for up to 10 years.
Oh my goodness.
So before your periods actually stop, like it can be a long time that you're going through all these changes. And we can't diagnose it necessarily on blood tests. So we don't just like get a blood test and say you're in perimenopause or not, because your hormones go up and down.
Right, because I've had friends who, you know, we're all kind of on the similar journey.
Yeah.
You know, I'm going to do some examinations, why I'm having so much fatigue. And a lot of them have come with like extremely low testosterone levels. So just in our conversations, we're like, oh, is that a perimenopause thing? What is it?
Yeah. And so we do test when people are younger. So if you're like under 45 and you're having a lot of these issues, we do test because it could be like a thyroid issue. It could be another hormone thing going on. You know, if you're in like your late 40s, 50s, like we don't need to test. Two reasons. One is that your hormones could be completely normal and you could be feeling awful. So we treat someone based on how they're feeling, not on the number. And the other thing too is that hormones fluctuate so much that, you know, somebody could be feeling totally fine and have numbers like estrogen levels and stuff that are like in super menopause range. And we wouldn't do anything for that because they already feel fine.
Yeah.
So we go based on how someone feels, and because the hormones fluctuate so much, we don't necessarily test. So the exceptions are if someone's younger, because we need to figure out what's going on. And then the other is testosterone treatment. So testosterone is an off-label treatment for low libido in women. It's not FDA approved. That's what that means. It's not like an FDA approved indication, but there's lots of research about it. So especially for postmenopausal women, we do check testosterone for that because you can go too high, and then people can have like, you know, the facial hair and all that stuff. So we don't want to like over-treat. But everything else, you know, if you're on hormone placement therapy for menopause, perimenopause, we go based on how you feel. So,
Can I ask a personal question?
Yeah, go for it.
So if I'm on birth control, I'm on like this one that's Seasonique, which makes you not, basically I don't have a period, but I like it that way.
It's great,
But is there a problem going that route for too long? I mean, I'm not planning to have children or anything.
No.
Good question.
So again, there's a lot of misinformation on the social media about like birth control is going to hurt your body and like it's going to like affect your brain and stuff like that. So I always tell people, first of all, when you see that stuff on social media, look in their profile. Almost always they're selling something. They're selling a course, they're selling a supplement. They're going to promise you all, they're going to say lots of scary stuff to make you scared, to make them desperate, and then you will buy their crazy detox thing, which is, again, they're always like, oh, this is so dangerous, but then they like sell stuff that's like not regulated, it's not like studied at all. There's
like
no
the
safety.
foot patches that detox you.
Detox stuff that you're like, what's even in this thing? And so there are obviously some risks to birth control, like estrogen. There's like a small risk of blood clots. You know, there are, you know, you can have like mood symptoms and things like that. But if you're on it and you're happy and you don't have a high risk of blood clots, you could keep doing that until you're in menopause. Like we keep people on birth control until they're in their 50s to prevent pregnancy. So as long as you're happy with it and, you know, you're...
So there's no like problem, because I feel like, am I putting myself on menopause because I'm not having the period? periods.
No. Yeah. It's not going to change like when your ovaries are going to shut down. And then when you are on birth control, hormonal birth control, you don't have to have periods because the progesterone hormone in them thins the tissue in your cavity that normally come out like period blood. So normally you have to have a period to flush it out. Otherwise, like you can get kind of dangerous buildup of tissue in your uterus. But if you were on the birth control, you don't actually have to bleed.
See, I love not having my period because I had painful periods that were just like, and like I had slug blood clots that would come out. That's very identifiable, but I mean, it was painful. And with being on this birth control, I'm like, oh my God, thank God I don't have that anymore.
Skip forever. So there's kind of a joke, but it's true. It's like most gynecologists have Mirena IUDs, the progesterone IUDs. And like most people with these IUDs don't have periods because the progesterone is so effective that there's nothing to come out. And so we joke, it's like what's it called, Mirena to menopause. Like we're just gonna keep on
Mirena to
like
menopause.
who has time for periods?
Yeah.
Who has time for periods? Let's get rid of them. So obviously some people prefer to have periods, and that's obviously
I
up
absolutely
to them.
do not.
Yeah, I know. But if you don't want to have a period, you don't have to have one.
I don't want my period.
So for
it's
people who have
unfair.
painful, heavy periods, we do this on purpose because we're like, why do you need to suffer?
Yeah.
So we will put them on a continuous method. Yeah, you don't even need to take the placebos in the season L, season E. Just throw them all out. Just keep doing
Which
continuous.
ones are the placebo?
The different color one at the end of the third pack.
Oh,
yeah.
wow.
Yeah, so you don't
I
even
don't
need to
know what those are.
You don't even. The only purpose is to bring on a period. So there's no need to do it. So we tell people just check them. Just only do continuous.
Oh my gosh, you've alleviated so much stress.
go.
I'm
Oh
always
gosh,
like,
I'm so
because I
glad.
did ask like a doctor this, and they're
Yeah.
like, yeah. I was like, what does that mean? Why do you hesitate?
I know.
Oh my gosh,
Well,
you
I
have such
think that's-
clarifying information.
Yeah, I mean, that's what I appreciate about, what you do and the education that you share on your platform, because I don't feel like I'm this empowered person when I'm sitting on the
Yeah.
in the
bed.
gown.
Yeah, in
You
the
feel like
gown.
an idiot.
No, and I was asking about
I
different
mean, I feel like an idiot.
options. I was asking about different IUD options, and I was very influenced by my mom, who never, who always was. She's like, she will seek a doctor for any symptom, but she doesn't like medication.
Yeah.
So for me, it was always like, no, you don't need like birth
Medications,
control.
Yeah.
So the first time I asked about that was after having my second child. And then I just got spooked when my doctor was telling me the different IUDs and the symptoms and blah, blah, blah. And I was like, okay, just give me all the brochures and I'll read it at home. And then I never looked at it again. I was like, I guess it's easier to just have my period, but it is very inconvenient.
Yeah.
Especially now that I'm done having kids. I'm like,
Yeah,
why am
for
I
sure.
going through this suffering?
Yeah. Well, so that's why in the book there's chapters on everything. So every topic, there's a chapter on birth control. It goes over all the different types, the risks, the benefits, like why you would choose one or the other. And then there's a chapter on, GYN exams, like going to the gynecologist, like
I
what
love
is
that
it
part.
like?
Yeah.
What's your experience going to be? How do you make it as comfortable as possible? And that was my editor actually suggested having that chapter in there because she's like, think about the average reader who, like you said, does not feel super comfortable. Like it's not a natural thing to go to the gynecologist. And people may be really nervous or wondering there's a lot of talk about like pain control with IUDs and like other procedures like colposcopies for abnormal pap smears. So there is a lot of a movement now to try and, give people some empowerment, to give them options for pain control. Like truly it was not great in the past. People were not really kind of given all of their options for how to make things comfortable. So, now we're really trying to give people more options to empower them. And then in the book, it talks about like, how can you make the pap smears like more comfortable, like all these things. So it should be that you go and you feel comfortable, confident, you leave feeling like that was a good experience. Like, I'm happy with how things have gone. So that's like the mission of the book, is to give people this information, which is, it's hard to find that information otherwise. Like it's no longer the case that people literally get all their information just sitting across from their doctor.
Correct.
There's not enough time.
No.
Like a lot of gynecology visits are like 15 minutes. Like they're too short to cover all this stuff. So people are looking for information on TikTok and sometimes finding some very bad information, misinformation. So we're trying to get solid information out there to people.
Do you feel so fulfilled?
I do.
Oh my God.
Yeah, it's very satisfying. And I get so many messages. People like will DM and be like, I was today years old when I learned this thing about my body that's been affecting me for like 10, 20 years. Like it makes so much sense now. Or I'm giving this to my daughter and so that she won't have to go through the same things I did and that she will have this knowledge right from the beginning. And I'm like, it's amazing. Or like a lot of times people will say like, oh, because of your videos, I realized I had endometriosis and I fought to see a specialist. I had surgery and like my life has changed. I'm like, this is the dream. Like it really is powerful. And I truly can't believe it sometimes that, I don't know if you ever look at your analytics. Like, do you look at your numbers?
Sometimes when I have to.
Yeah.
When I have to report them.
Right. Exactly. Yeah. Occasionally I have to be like, okay, I have to look. I don't usually look at like the full year worth. Like, but for some reason, Under the Desk News. I don't know if
I love her.
B Spirit. Yeah. So had posted something and I was like, that's a lot of people in 1 year. Let me just see what mine was. It was like 59 million views in 1 year.
That's
and I have a lot fewer followers than you do. You probably have a lot more. But I was just like 59 million people in 1 year. The amount of impact that you can have, like maybe like who knows how many of those people will see it and be like, oh my God, like maybe I have endo, maybe I have PCOS, maybe I have PMDD, and like actually got their life changed. Like it's amazing.
Yeah. And the platforms social media that makes it so accessible. Yeah. Of course, there is the danger of, you are also constantly being fed the misinformation, right? Which is why I think it's so important for people like you to be on there and kind of, filter through that noise. Yeah. I'm curious to know what happened in your experience as a clinician that made you the person you are. I mean, because, I don't think every doctor is this, compassionate, wanting you to be like your own best advocate. So how did that, like your formation, how did that happen?
Especially because you talk about like, I didn't think that women should be surgery, or like you had these preconceived. How did you break that?
I think, like starting from the very beginning, the fact that I had so little information and as soon as I was then in the world of OBGYN, I'm like, oh my gosh, like why doesn't everybody learn this stuff? Just kind of already feeling like, wow, most women don't know most of these things about their own body. It just seems so crazy to me. Yeah. And then, being around people who are more open, like realizing that you could have that openness, it was very transformative. Like, again, like I come from like Asian background, like we don't talk about anything like about like sex or bodies or anything. So like then kind of being part of a community of healthcare providers who, obviously by nature, we're talking about sex. We're talking to patients in the office about their sexual health, and wanting to kind of bring that messaging out there a little bit. Like I said, when I started on social media, I was very much not like, oh, I'm going to be in front of the camera. I hated that. I don't take selfies really. Like I by nature, I'm not someone who loves being in front of the camera. But like I said, I like to teach. Yeah. So knowing that there was that need out there, and I realized very quickly with social media algorithms that you have to be on camera for it to kind of, I couldn't put a picture of a mountain. I did, honest to God, if you want a good laugh, if you scroll to the very beginning of my Instagram, it's like pictures of flowers and mountains and stuff, because I didn't want to put my face on there.
Wow.
So
and you're talking over it?
Oh my God. No, it wasn't videos, but it was just actually Instagram pictures.
That's funny.
So literally I would write a huge caption with some educational something. And then, I would, so then I realized, oh God,
people like talking to somebody.
People like identifying with the person. Yeah. It's just human nature. And and then TikTok obviously became video, and I was like, oh God, I have to get in front of the video camera and say stuff. But part of it was also just seeing the stories of my patients. So as a doctor, how many years women went through from, their teens to their 20s to their 30s, seeing doctor after doctor after doctor, who, like very good intention, but they've absorbed all this stuff like that. Oh, periods are supposed to be super painful. This is all supposed to be, every woman goes through horrible pain. And that's not true, but that's, doctors are human. So they've absorbed all of this misinformation too, in a way. And so, seeing how difficult it was for people to kind of get care and how great their lives were after they finally got care, I was like, I need to say something. Like, once I started doing social media and started getting a little bit of an audience, I'm like, I kind of owe it to the public to try and get this message out there.
Yeah.
If you can spare 1, 2, 10, 100, 1,000 people from having like the years of suffering, like of course you're going to do it. And so just being motivated by hearing the stories, and obviously the title, It's Not Hysteria, just reflects what so many millions of women, people assigned female at birth, have gone through in their life trying to get someone to take them seriously. It was it's obviously very motivating. So it's hard.
If we had more doctors like
Right?
you, our healthcare system, like
seriously.
your motivation, your inspiration of why you started,
thank you.
it's I want to be you.
Oh my
I mean,
God, you're
not
so
a
nice.
doctor,
Yeah,
but
you're like without the stressful part. Yeah.
No, I'm definitely just a clown. But it's so you're a dream, like to help people.
Yeah.
Absolutely.
And I will say most gynecologists have a similar passion for helping women. Like you don't get in, like OBGYN is one of the most stressful fields, one of those highest malpractice, like longest hours. I don't do obstetrics. I don't do the pregnancy childbirth part, but the people who do, I mean, like they are so dedicated to it. The problem, and I talk about it in the book too, is it's the system. So women's health is so poorly valued that this is where, most people, when they see their OBGYN, the waiting room is packed. Like the doctor's seeing like 40 patients, 50 patients a day. Just because to keep the doors open, you have to see a certain number of patients. So to be able to, they don't have time. Like they have like 10 minutes. They got to like get through a million things. And there's just not a way to sit and like really counsel someone, listen to their fears, like go over pluses and minuses. Like they're like, I got to get in. I got to spend however many hours charting afterwards. So the system has kind of set it up to fail people who even want to do a good job.
When as a patient, you're already intimidated. Yeah.
So a lot of us, in my specialty, I specialize in endometriosis, and patients are very complex. Like there's so much to go over. There's surgeries. So a lot of us have gone out of network. Like I just started a new practice. So we're outside of the insurance system. Like we still can like submit for reimbursement, from out of network plans, whatever. But it just gives us a little bit more freedom to spend time with patients. Like that's why a lot of people's psychiatrists, psychologists, mental health professionals, or primary care doctors are also going out of network just to be able to spend time with people. So the healthcare system definitely is broken in a lot of ways. We're trying to do the best we can within the system, but it is tough. And I don't want to make it sound like I'm the only good gynecologist, because everybody who goes in the field went into it with this passion, but kind of got beat down by the system a lot of times.
What about the men gynecologists?
Yeah.
That weirds me out, but that might be my bias.
No, I also... I have a primary care. I'm like, oh my God. They switched me over to a guy because my doctor retired, female, who I loved. And it's a guy. I was like, oh yeah, I could see a guy doctor. But then I was like, wait a minute, what about my pelvic exam? I don't want to see that dude.
I will say the men gynecologists I know are some of like the nicest. Again, like to kind of go into this field, like you have to be a certain type of kind, good person. So some of the men in the field are truly like the nicest, like most well-meaning. And obviously they know a lot of women don't feel comfortable with a male provider and they don't take it personally. But so obviously you choose who you feel comfortable with. So don't, choose who you want to see. But just to know that it's not like most male gynecologists are very kind and nice and very skilled. So.
One more question. I mean, we're from Seattle, so
yeah.
do you watch Grey's Anatomy?
I never really did. This is how old I am. I think my intern year was the first year of that show, I think.
Wow.
So I started intern year 2005.
So you started with them when
yeah. So I overlapped with Scrubs and the beginning of Grey's Anatomy, and Scrubs is much more accurate. I will say. Everyone says this. If you poll a doctor, if you poll doctors, the most accurate medical show is Scrubs by a long shot.
Really? I would have never expected that.
For sure. And Grey's Anatomy is like a soap opera. Like they just like make stuff up. Like
but Scrubs is a comedy.
Yeah. But they based it more in reality. Like the actual experiences were like much more realistic.
That's so fascinating.
So and the Grey's Anatomy stuff, we always like make fun of it because we're like, what? Like they have like one specialist that does one fetal surgery. Like they're running the ER, they're doing radiology stuff. Like we were like,
well, which doctor would
there's
you?
one doctor in each department.
Right. I know. There's like one neurosurgeon
and one intern.
But there's like doctor character types. Which would you most? Are you Meredith Grey?
No, Addison. No, well, she's like an OB.
Yeah,
I mean, character-wise, like personality-wise.
I mean, I guess well, of course, I only watched a couple of episodes.
Yeah.
Like Christina Yang, when she was,
Christina Yang.
of course.
Yeah, okay, I didn't want to jump to that.
Where, you were like, you had a certain amount of confidence, but like also were like, maybe I'm a little bit of a mess. I don't know. And so
I thought that you were more that the boss doctor.
Black
Bailey.
doctor. I do feel like Bailey
Dr.
now.
Bailey.
Now I feel like Bailey.
Yeah,
You have a Dr. Bailey presence to me.
Now-
I
now-
actually didn't think Christina Yang.
You have
when
a
you said it, I was like,
maternal-
oh yeah, Christina Yang.
Yeah.
But I was actually thinking Dr.
Now
Bailey.
I
Yes,
do. So
yes.
of course back then, but now that I've been in practice for like 14 and almost 15 years, I'm like, I'm totally Bailey. I'm
Yeah.
like,
Yes, you
I'm
have
like,
that,
get
like-
your shit together,
Yeah.
everybody.
Yeah.
Like,
But
come
also
on.
that mothering, sort of like nurturing, like
Yeah, yeah.
everybody calm down.
Yeah.
Like, yeah.
Exactly. We're like,
So you're
let's all
like-
calm down. Let's get it together.
Yeah. You're working your own practice. Would you ever, you think, want to go to a teaching hospital and do that?
No, I mean, I work with residents now, so I still teach
Okay.
residents. Like they operate with,
Yeah.
they come, to my surgeries and I operate with them. But I like my independence now, and so it's hard to obviously do like coming to see, like traveling for book stuff and balancing
know.
social media. It's hard to be employed and do that. But I love teaching. Like I said, I've always wanted to teach trainees. So
You are a teacher,
yeah,
like through and through.
I've always had residents and medical students who I like to pass things on. And so,
Yeah.
and I'm a very low key teacher. So there's some doctors who are like, we call it pimping. You like, like you grill them, like explain the Krebs cycle. And, I don't do that kind of stuff. So I just like teach. I just tell them like, like this is what we think of when we're evaluating somebody for endometriosis. This is how you approach the surgery, like very low key.
I love your clarity.
One
Yeah,
thing that she
I
does
try.
is she draws the
I draw the
pelvic
pictures.
anatomy for
Yeah.
anyone and everyone.
Yeah. I just did an interview. Somebody I know is a reporter for New York Times, Rachel Gross. She wrote Vagina Obscura, which is a great book. Everybody should check it out. But she's doing an article on hysterectomies, and she was interviewing me and one of my patients who had a hysterectomy. And she loved the idea of the drawing. She had me take a picture and send it to her. So I use a whiteboard. I literally draw like the uterus, the cervix, the vagina, the tubes, the rectum, all of it. Because a lot of times people are like, what are you talking about? Like, so, imagine if you were having surgery on your eyeball, like I would want to know, like what part of my eyeball are you operating on? And so for women's health, I think a lot of people may assume that because if you have women parts, you must know what it all is. And that's not necessarily true.
I definitely don't know where things are.
Yeah.
I would need a diagram.
Yeah. And a lot of times I've had patients who have had surgeries, have had hysterectomies, and they're like, I don't know what it was for. Like, no, it's true. They're like, the doctor didn't tell me. They were just like, oftentimes it was more older women. And especially when I lived in Florida, like people from other countries.
You lived in Florida?
Oh, yeah. For Miami for 4 years. So my husband got a job there. And it was crazy.
You're a survivor.
I know, it was wild. But yeah, people would come from other countries and be like, I don't know why I had the surgery. They wouldn't know what had been done.
Crazy.
They would have had a surgery. They didn't know what had happened in the surgery.
my.
They were
Oh,
like,
that's
I don't know what they
scary.
did.
Oh my.
So I'm like, that drove me insane. I'm like, how can you let someone operate on you? But that's just the culture.
Yeah.
So for me, I'm always like, if I'm operating on you, I want you to know why, what I'm doing, what I'm operating on. You should know that.
Yeah.
So I want them to visually be able to understand.
Yeah.
Because like,
I love
sometimes
that.
it's hard to just like describe like, well, we're going to take your tubes and your cervix and what does that mean?
Yeah.
So I draw it all out and now
And
I have
I'm
some
a
of the
visual
videos.
person.
Yeah, most people
Yeah.
are for
Yeah.
this kind of thing. So I also have a couple of YouTube videos. I have the short, which is the TikTok, which is the video of the hysterectomy, which shows like all the organs in real life.
Yep.
It's very cool.
How do you have the time?
I don't do much sleeping, and I don't think you don't have like a team for your TikToks, right? I don't
No.
either. So I do it all myself. Like I know people who have like a production team for
Right.
videos. I don't yet, and so I'm too much of a control freak.
Yeah,
just do it
so
myself.
am I.
Yeah, that's why I haven't done too many YouTubes because you need a whole team for YouTube. But like, there's just no way to do that. But yeah, I just kind of like knock them out, and like I am not the most technologically savvy person in the world. Like 17-year-olds on TikTok are much more like like
You're not
good
doing
at all.
transitions?
Right? I'm like they know how to do all the cool effects and stuff. Like much as mine is much more just me talking, and sometimes I'll put a green screen of an article behind me or a
Yeah.
diagram.
Right.
Yeah.
That's as far as
That's
I
basically
go
it.
too. Yeah.
Yeah.
Yeah, I mean, just love that you so skillfully debunk things and also tie it so well with what's happening today, especially with the political climate. I saw your recent video about JD Vance.
Which one?
Confusing the IUD and the IUI.
Oh, God.
And
yeah. So, like, this is part of, in some ways, not that I like do the news, but I almost feel like there is a need for healthcare providers to respond to these things in the news, because so much of it is misinformation, and people are going to be voting based on this misinformation, and it's so important to be like, no, like that's not correct, like this is wrong, and this is why it's wrong, and if you are going to put your health and your body and your rights in the hands of somebody who doesn't even understand how the body works, like this is why like so many gynecologists are starting to be politically active. Before like 2016, most of us kept our politics to ourselves. Like we didn't really feel
you probably never thought you were going to be an activist.
I never thought I was going to be like a reproductive rights freedom fighter or anything like that. So when I was a resident, we had older attendings who had practiced in the 70s before Roe v. Wade, and they would tell us horror stories like, oh my God, we'd have entire units of women who had perforated organs, who were septic from like illegal abortions. And it was like, oh, from a different time. Like we were like, oh, how horrible. Like
it seems so
long ago and so barbaric.
Yeah.
And we're like, thank goodness we're never going to have to deal with that. And it was just in the news that a woman just died in Atlanta because she couldn't get care. She like had an abortion and she like bled. I think like she became septic. And then a woman in Ireland died because of sepsis, because at the time abortion was illegal and she had broken her water and they couldn't intervene until she was nearly dead. And then she passed away. So again, this is where when you have people who don't understand the medical realities of stuff, making laws and decisions that then, doctors could lose their license. They could be convicted of a felony if you help someone who is, like getting an infection from a pregnancy, and you have to treat that's an abortion. So so many of these things are just about explaining the reality. I never get up there and just like do like histrionics. Like I'm never just like, this guy is terrible. It's always about explaining the facts. It's always about like, here is the reality. This is what someone said. This is how it's inaccurate. And this is why it should matter to you. And so, trying not to be like, oh, I'm just like, like on a soapbox about like, I just don't like this politician. It's not about that. It's about, what are the ramifications for you, the person who's out there trying to figure out what to do.
Yeah. Well, it's all connected, right? And all the more reason to empower just regular people with information about our reproductive health, and then why we should care about our reproductive rights, and why we should care about how, certain people running for office, where they stand on those issues.
And that's why, with the book and the social media, it's why I hope it's not just women who read it. Like people, I've heard people say, oh, like, make sure you give it to all the women I know. I'm like, give it to everybody now. Because, there's stuff about how pregnancy happens, birth control, abortion, gender, and if you're a man, someone who's a woman who has a uterus who is going through these things. So it's so important for everyone to kind of know about this stuff. So we should all kind of feel invested in it. And it's a little bit of a joke, but on TikTok, they're always showing like videos where they interview men and they're like, where's the clitoris in this diagram? And they don't know.
Oh, yeah, right.
Or like they don't know that you can pee with a tampon in, or like how many ovaries does a woman have? And like most of them can't answer that question. And it's played as a joke, but it's kind of sad. Like it's just because no one's ever taught them these things. And then, those men are obviously sexually active. They're going to be in relationships where maybe the partner could get pregnant, and all of these things. Like it's important for everybody to be
How
educated.
old do you think you can give?
Teenager. Yeah.
Like 17?
Yeah. I wrote it so that like a teenager could understand it.
Okay, I'm going to make my 17.
Please, yes.
When he's 17,
yes.
This is going to be your summer reading.
There you go. Perfect. Good. And then, like I said, I tried to read it. I tried to write it so that it could be understandable, for the whole gamut of ages, because I didn't want it to be just for, women of a certain age. So somebody who's in high school or college, who's just sort of like like figuring everything out to somebody who is, you know, postmenopausal. I actually just had, this is an amazing thing. My friend who's a fertility doctor, she was actually one of my expert readers for the infertility chapter. She brought her mom to an event of mine recently, and her mom's like 89. And afterwards she texted me, she's like, my mom said, I wish I had this book when I was younger. I would have understood my own body. And I was like, oh my God. So that just so moving. Like, you know, like obviously there was no social media. Like you probably didn't talk with your family. Women just sort of had to figure it out somehow. I don't even know how they would figure these things out. They probably didn't. And so it's really exciting now. We have, you know, books that you can find in all of your local bookstores. You can go to the library. You can, you know, like get these resources on YouTube. Like there's so many places for people to go now. It does make you realize it wasn't that long ago. Like, you know, like really a couple of years ago. It wasn't like even a generation ago. That when we were kids, like there was no social media.
Right.
Like, all that stuff,
Google was not free.
Yeah.
I mean, it didn't exist.
Yeah.
So it was hard to find.
You're a dream.
Yeah. I love you guys.
So
I was saying this. I'm like, I'm great.
I'm like, wow, I want to be like this when I grow up.
My
like,
ego is going to be like
well,
you know,
in closing, besides reading It's Not Hysteria, what is one thing that we can do today to just be better advocates for our reproductive health?
Yeah, so I tell people a couple of things I hope that everyone does. One, to learn all these things. So, you know, be it the book, you know, through my platform, or like others. There's so many other, you know, great gynecologists out there, you know, Dr. Jen Gunter, Dr. Jennifer Lincoln, good friends of mine. So other gynecologists who are on social media doing a lot of this educating, and then talking with people. So even just like this, like talking with your friends, normalizing it, talking with relatives. So again, it's so exciting to me when people are like, oh my God, I talked with my daughter, I talked with my mom, my friend, my sister, and just kind of those little ripple effects. I've had a couple of people who started like, or they had like regular women's meetings at their job. So that I thought this was amazing. So they would do book clubs with all the female employees, and they would read the book together and have a discussion. And I was like, that's great. Because then, you know, again, it normalizes what everyone's going through. If someone's going through menopause symptoms, going through infertility, that there's that openness in like the workplace. You know, you can get like kind of, you know, your employer to kind of help with like accommodations or coverage or whatever. And then also to advocate. So a lot of things like endometriosis, cancer, all that stuff, like people, there's such strong like advocacy communities where people can go for support. So, you know, other people who understand what you're going through, that can help with resources. A lot of people find their doctors through these online groups where, you know, they're like, oh, I've had really hard time finding someone who, you know, like understands about this. Who did you see in this area and who did you like? And people will like crowdsource like where to find a doctor. Yeah. You know, that you can do that for endometriosis, menopause, gender. If you're child-free, there's a huge child-free Reddit. If you're looking for sterilization, a lot of people find me through that group, which is amazing. And so there's all these online communities that can then help with pointing you in the right direction if you're not sure where to find a doctor who can help you. And yeah, just like keep the conversation going. And then also, your story has power. I like to leave people with this because sometimes people are like, well, you know, I can't really make a big difference here. Yes, you can. Like just sharing your story with someone, you know, whatever sphere of influence you have in your community, in your family, in your workplace, try and use that to make things a little bit better, to make a little bit of a positive change. And hopefully, like I said, we get those ripple effects. It's hard for one of us to do a whole lot, but together, all of us can do, you know, we can make some sort of big impact. So thank you, guys. Oh my
Thank
God.
you
I'm going to move to Seattle.
I'm
going to
Please
here.
do.
We're just going to hang out.
We
It's
need
going to be
you
like
here.
all three of us on the podcast all
please.
times.
Just come on down.
Yes. Or you can come every month and we
There
can
you
just
go.
answer
Anytime.
questions. Yeah.
Anytime. Please come.
You guys are the best.
Oh, you're the best.
Yay.
Oh, I'm fangirling so hard. Thank you so much.
I like how we're applauding each other. We're like, we're amazing.
Ooh, yes.
Thank you.
Yeah.